Hello and good evening, everyone. I hope you are all well. Please let me know if you can hear me so that I can go ahead and start. Thank you so much for joining me today. I hope that I'll be helpful to you. I hope you'll be able to learn a thing or two to solve every single problem that you have. If you are here today, it means that you probably have gone through a loss or two, and you're looking to have solutions, or you're hoping that your next pregnancy would end on a good note. So just give me a high five or a thumbs up so I know you can hear me as I go ahead and start. Just in case the video goes off, it might be probably because I've been called to go and do a delivery or see someone else, but I definitely will be back. If you realize that I'm saying things that you do not understand, just alert me. I would go back and explain again. Okay. So today's topic, or today's workshop, is about pregnancy after miscarriages or stillbirths. Okay, so we will talk about miscarriages, and we'll talk about stillbirths, and we'll talk about what it is that you can do if you have gone through any of these traumatic experiences, and how you can make sure that your next pregnancy ends on a good note. So we know that there are so many things that can cause miscarriages. There are many times that miscarriages happen, and we ask ourselves, is this really something that was meant to happen to me? Why did this happen to me? What's going on? Is this going to happen to me again in future? And so many other questions that you might have. But there are many times that we don't know why miscarriages happen. But very often we know that miscarriages happen because there was some problem genetically with the egg and the sperm that came together. For example, if the egg and the sperm meet to form a baby, and the body realizes that this baby that is being formed doesn't have a hand, or doesn't have a leg, or isn't going to have a good life, the body is going to get rid of it by itself. And this is something that you cannot do anything about. There's nothing you can do about it. It is not your fault that this happened, and you shouldn't blame yourself too much. Most miscarriages happen because of this, because there is a genetic problem wrong with the baby that is forming. There are some miscarriages that can also happen because, for example, you took a medication that does not support pregnancy, or isn't meant to be taken during the first trimester, or you can't hear anything. Okay, sorry about that. Just a moment. Can you hear me now? Please let me know if you can hear me so that there are sometimes that you could probably take a medication that isn't meant to be taken during first trimester, that can cause you to lose your pregnancy, or that isn't meant to be taken during the entire pregnancy period, that could cause you to lose your pregnancy. Okay, so despite the fact that genetic problems are the most causes of miscarriages, there are things that you could do, or there are things that you could actually overlook, or things that the mistakes that you can make that could actually cause you to lose your baby. So we've spoken about the genetic aspect of it. It doesn't necessarily have to be just you. It can be because your partner is also giving you poor quality sperm. So you can be okay producing good eggs, but if your partner brings poor quality sperm to fertilize the egg that you are bringing and form a baby, the baby would not hold because the sperm is not good quality, and doesn't come about, or doesn't lead to the formation of of a good baby. Okay, so genetic problems, done. Then you can also have a miscarriage because you have a problem with blood clotting. This usually happens in women who miscarry once, then they miscarry again, and then again. There are sometimes, or there are lots of times, that if you fall into this category, your OBGYN might put you on, for example, aspirin to make sure that your pregnancy holds. And lots of people actually are able to carry their pregnancy to term just because this is their problem. If you have a problem with blood clotting and you are not put on aspirin, once your baby forms, the blood clots form with your baby, or blood clots form in the blood vessels that are supposed to produce or are supposed to send nourish your baby. And once it blocks these blood clots, block the blood flow to your baby, a miscarriage is going to happen. So if you fall in this category, your OBGYN might give you aspirin to make sure that your pregnancy holds. You shouldn't, however, take aspirin on your own, as not every pregnant woman is needs to take aspirin. Okay, it's not recommended for every pregnant woman. So if your OBGYN gives you aspirin, fair enough, you can go ahead and take it, but otherwise don't prescribe aspirin for yourself, because we have specific doses that we give to specific people. Okay, so if you're not sure, if you prescribe the aspirin for yourself, you might take it as a wrong dose and at a wrong time, and it won't be functional. Okay, so another reason why you might have a miscarriage is because, for example, if you have a fibroid that is growing in your womb, okay, and the fertilized baby sits on the fibroid. You all know that the fibroid is a very like very hard. It's like a rock, okay, and because it's separated from the womb wall, there's no blood flow, or there's no nourishment. You don't get a direct blood flow from the blood vessels of the womb wall. So when your baby sits on the fibroid, it's not going to get enough blood flow to support the growth of the placenta and the growth of the baby by itself. So what's going to happen is that it might stay for maybe 5 weeks, 6 weeks, and once it begins to need more blood than necessary, you just miscarry, because now where it's sitting in the womb is not conducive, or it's unable to produce or provide the nourishment that that baby needs at that particular time. This is one of the reasons why your gynae might tell you that if you have specific types of fibroids growing in specific places, you might need to go for a myomectomy, and after that try to conceive, and pregnancy usually holds, and you're able to have your healthy baby at the end. Okay, if your hormones are not in place, you might wonder why you're having one miscarriage after the other. But if hormones are not in place, you are going to miscarry. The body needs all hormones to be balanced, your female hormones plus your male hormones, plus the hormones of the thyroid gland. Everything needs to be balanced. If you happen to have too little female hormones, the pregnancy is not going to hold. If you happen to have problems with your thyroid gland, which is the gland that is here, your baby is not going to, your pregnancy is not going to hold. You keep having multiple miscarriages. If you have too many or too high male hormones, usually seen in women who grow a beard, begin to have like a male or masculine like voice, they are very hairy, your baby or your pregnancy will not hold. So for your pregnancy to hold, your hormones will have to be in check as well. There are lots of women who have no idea that they even have diabetes. Okay, so this is one of the commonest reasons why people have multiple miscarriages. You might be miscarrying so many times just because your sugar level is not in check. So if you are having one miscarriage after the other, and you think that your hormones are in place. It's important for you to check your sugar level as well and make sure that it is okay. If your sugar level is not okay, you have to work with a diabetician, a doctor that is responsible for taking care of patients that have diabetes, not just a dietitian who will put you on a diet to make sure that everything is okay, but you specifically have to work with a diabetician to make sure that your sugar level is okay before you start trying to conceive. If you need any other tests based on how bad your diabetes are, for example, if you need to go and see a GP to check your heart, to check your blood vessels, to check your eyes if everything is okay. All these things need to be done. You can't work with a dietitian. Sorry, you can't work with a dietitian and expect that because the dietitian will put you on diet and you have diabetes, everything is going to be okay. When it comes to diabetes in pregnancy or diabetes before you try to conceive, a dietitian is always very, very important. So if you are miscarrying so many times, it's important to check your sugar level as well. Okay. You might also have a miscarriage or two, or you might be having a couple of miscarriages just because you have specific infections. For example, I don't know if you have heard about herpes, but women who have herpes have usually have multiple miscarriages. If the herpes is not taken care of, you will have miscarriages. If you have, for example, syphilis, if you have tuberculosis, you could also have multiple miscarriages. If you've had a couple of DNCs and your womb has been scraped so much so that the wall is very, very rough and it sticks together. Once your baby sits at a place where the wall of the womb isn't too conducive, the pregnancy is not going to hold. Okay, so that is also important. That's why there are some people who say that if you've had many abortions, or if you go for abortions, you might not be able to get pregnant again, or you might be infertile. It's not really because of that. It's just because when you have an abortion and it's really traumatic, or the person who does it for you doesn't really know how to do it, and scrapes your womb so hard, you might find it difficult to get pregnant later in life because of how they destroy the inner lining of the womb. Okay. Um, if you look at infections like chlamydia or syphilis, these can also cause you to have multiple miscarriages if they are not treated. Okay. If you have, for example, malaria at the beginning period of your pregnancy, you can have miscarriages as well, or you can miscarry as well. It's really, really important for you to have your malaria taken care of. You can't say that, okay, I know how to take care of malaria, I know how to treat it myself. So since I'm pregnant and I can just like take a pill or two and feel better, I will just do it myself and stay at home anyway. It's not going to affect my baby. It very likely will affect your baby. If you think that you have malaria, go and seek help from the right source. Okay. Now, if you have problems with your cervix, there are people who happen to have lots of like miscarriages around 15, 16 weeks, 17 weeks, just because their cervix opens too early. If you fall in this category, your gynae would want to put in a cerclage for you, and this is like a sewing of the tip of the cervix so that it doesn't open before time. Before a cerclage is done for you, it's important that your gynae rules out any infections in the vagina, because if the cerclage is put in place and you do have an infection, it's going to fail. You're going to have your baby would very likely have an infection, and you would begin to have contractions. Once contractions set in, there's nothing you can do about it. The cerclage stitches will be removed, and you will deliver, or you would miscarry at that early stage. So before you have a cerclage, it's really, really important that vaginal infections are ruled out. Your OBGYN will also like perform an ultrasound to make sure that everything is okay. You'll be put on antibiotics to make sure that no infections are gotten, and you'll be given medication to stop contractions for a couple of days. If this medication works and cyclage is put in place, then it will be left until you are around 38 weeks or 2 weeks before your planned delivery date. Then it will be removed, and then you can possibly go into labor yourself. Okay, so if you have problems with your cervix, it's always important to make sure that you do not have any vaginal infection before a cerclage is put in place. If you do have a vaginal infection, the cerclage is not going to hold. Okay, in women who have who are RH negative, that's rhesus factor, who have the blood group negative, and they've had like a one baby or one pregnancy or a miscarriage that they did not receive the anti-GD injection. When the body becomes sensitized to it, you might have miscarriages, or you might have problems with stillbirth in future, just because your body begins to react to your baby's blood if it's not compatible with yours. Okay, so in the case where your blood group is negative, you can ask your OBGYN to perform some lab works to see if you have already been sensitized or not. If you have been sensitized, or if your blood is going to see your baby's blood as a foreign material and try to, or begin to destroy it when you get pregnant, your gynae would know exactly how to monitor your pregnancy and what to do at each stage to make sure that your pregnancy ends on a good note. Okay, so you all know there are different types of miscarriages. There are ones that are very silent. Your baby is alive in the beginning, and all of a sudden, after a few weeks, after a week or two, you go for an ultrasound and there's no heartbeat. That's what we call a mixed miscarriage. Sometimes you'd realize that you'd all of a sudden start bleeding, and you go to the hospital. If your cervix is closed when you're bleeding, your gynae might and your baby is alive, your gynae might hospitalize you and put you on some hormones to make sure that the bleeding stops, and once everything is okay, you'll be sent home. However, if your baby is alive and your cervix is open at that early stage, there's really nothing you can do about it. There's nothing your gynae can do about it, and all that is going to happen is they're going to wait for you to miscarry, or you're going to have a DNC, your womb cleaned out to prevent you from bleeding too much. Okay, you also have a complete abortion, where your womb empties its content by itself. You go for an ultrasound later and you realize that you're not pregnant anymore, and you have an incomplete abortion or incomplete miscarriage, where the womb tries to empty its content, but it's not able to empty everything. Some are left, some of its content is left there, and your gynae is supposed to clean out the rest to make sure that you don't get any infection, or to make sure that you don't bleed too much. If you happen to have an incomplete abortion or incomplete miscarriage, it's important that you are given antibiotics before the procedure, or very early after the procedure, or immediately after the procedure, because in the case where your womb does not empty itself completely, you can have an infection. And if you do have an infection of the inner lining of the womb, pregnancy in future might be a problem, because it damages the inside, the inner lining of the womb, such that when you're pregnant, the baby tries to attach itself, it doesn't attach very well, and you would miscarry. Same happens, or same applies to if you have a missed miscarriage, and you have to undergo DNC or evacuation. You have to be given antibiotics to prevent this infection, or the infection of the inner lining of the womb. Once antibiotics are given, you very likely should be able to get pregnant later on. if you've had a couple of miscarriages, we always advise that you do wait for 3 cycles before you get pregnant again. Okay, so you wait for 3 cycles, you wait for your first menses, your second menses, and then your third menses, then you get pregnant again. If you get pregnant too early, we open the cervix, we dilate the cervix to be able to get to that pregnancy. And once the cervix is dilated too much, you might have problems with preterm birth because the cervix doesn't have enough time to go back to its original state. It's not recommended for you to get pregnant too early, and it's not recommended for you to wait too long after 6 months, after 1 year before you get pregnant, because pregnancy becomes a little more difficult if you wait longer. Okay, so multiple miscarriages, you make sure that you start trying after 3 cycles. Once you're waiting to try, you make sure that you take your prenatal vitamins. If you cannot afford prenatal vitamins, it's important that you just buy folic acid, which should be enough to support your next pregnancy. If it was just because of um, um, if it was just because you lacked folic acid. Okay, you're also supposed to eat well, you're supposed to lose some weight if possible, because you cannot lose weight when you're pregnant. It's not advisable to lose weight when you're pregnant. If you think that you are not moving enough, it's important that you also add some physical activity to your routine. That increases your chances of pregnancy. It does increase your chances of pregnancy a lot. If you've had one miscarriage, not a problem at all. 1 in every 4 women does have a miscarriage, and we don't really, it's not considered as a problem. If you do have 2 miscarriages, you can decide to work with your gynae such that you are put on a combination of meds to um, make sure that your next pregnancy holds. However, if you decide to just give it a go and it doesn't hold during after the third miscarriage, it's always important for you to go for complete testing. Go with your husband so that your it's checked whether the problem is from you or from your husband, or if you have like any diseases or any blood clotting problems, etc., etc. It's not worth it for you to keep trying after a third miscarriage, despite the fact that you do not know what is going on. There are lots of times that the simple there is a simple solution, but the ladies usually do not come in. They go in for herbal treatments, and they go in for all sorts of treatments. They go into prayers. They do everything else but work with the doctor, and it's very stressful, and it's totally not worth it. If you think that you have a couple of miscarriages and you want to get pregnant, or you really think that you need help, work with your gynae. It's going to help you, and it's going to save you lots of stress. One thing I didn't mention is age and miscarriages. You know that sorry you know that the more you grow, the more um, how do I put this? The more you grow, the more the eggs that you produce are not good quality. Okay, so when you are above 35, the chances that you produce an egg that has a genetically wrong information is pretty high. So you might notice that people who are above 35 will keep trying and keep trying and keep trying, and would keep having multiple miscarriages. This is just because the eggs that they are producing are poor quality. So if you think that you are above 35 and you've had one miscarriage, you've had 2 miscarriages, it's 100% recommended that you work with your gynae. You have a complete checkup to make sure if everything is okay. If you keep having miscarriages, it's recommended that you see a fertility specialist, and possibly you can have some of your eggs harvested, and once the eggs are harvested, your partner's sperm will be fused with it, or the eggs will be checked to see if the quality is good, and then fused. Once fusion is done, it can be implanted in your womb, and you can have a perfect baby or a healthy baby. After 35, there's a higher risk of Down syndrome, like you all know. So if you have you're pregnant and your body realizes that your baby might have Down syndrome, it's possible that it's going to tell itself, okay, this baby does not deserve to come into this world, and will just cause you to miscarry. Okay, so age is a very important factor when it comes to multiple miscarriages. If you've had a couple of miscarriages and you're trying for too long, if you're below 35 and you're trying and you're still trying, and after 1 year you haven't been able to get pregnant, it's about time to you work with your gynae to put you on meds to make sure that you get pregnant. And once pregnancy um does not come through, he or she will send you to a fertility specialist. Okay, if you are above 35, your time of trying is maximum of 6 months. Once you try for 6 months and it doesn't pregnancy doesn't happen, you go immediately to a fertility specialist to help you out. Okay, so we've spoken about these miscarriages and what it is that you can do after one miscarriage, after two miscarriages, after three miscarriages. Folic acid is always key. It's very, very important for you to take folic acid. It's important during the first 12 weeks of pregnancy. After that, your baby has already formed all the parts that it needs, and it's not necessary anymore. You can get all the vitamins that you need, or that your baby needs from the food that you eat once you are eating very healthy. Okay, so now let's take a look at stillbirths. In as much as we know that these things that can cause miscarriages can cause stillbirths as well, we're going to look at specific things just in case that you have had a miscarriage. You should pay attention to these things that cause stillbirths, because you never know what can happen should you get pregnant. Once you've had a couple of miscarriages, you are a high risk pregnant woman. You are high risk, and you should in no way work with a midwife. You should work with an OBGYN. You should work with a gynecologist if you can afford it. Unless, of course, you cannot afford it. If you cannot afford it, make sure that you find yourself a very, very good midwife to walk you through your pregnancy, because high risk pregnancies are not supposed to be managed by midwives. Midwives manage pregnancies that are usually not complicated. Okay, so if you're after multiple miscarriages, you know what to do. So now let's take a look at a couple of things that can lead to stillbirths. Okay, so age. Age is one thing that could increase your risk of a stillbirth. The older you grow, the more your body, your body is tired already. Your body does not function as well as a young person. An older woman who is pregnant will have problems with, or will very likely have problems with diabetes, will have problems with blood pressure, would already have problems like with the maybe the heart, the lungs, so many problems in the body. Okay, so when you are old, or when you are about 35, you your risk of having a stillbirth just because of how your body functions is pretty high. Plus, because of your age, you might have a couple of complications during pregnancy that could lead to stillbirth. This also applies to children who are below 15. So you see some people who would see a 15-year-old girl, 14-year-old girl who is pregnant, and despite the fact that they know that this pregnancy is going to be very high risk, this mother might not even survive it because of the complications that can arise as a result of her being so young. They leave this mother to carry the pregnancy, and if she is fortunate, let's say she ends up having a stillbirth and is able to continue with her life. But once, if she doesn't have a stillbirth, or if she's able to go through pregnancy successfully, then at that young age, her future just ends like that. Because as we know in our society, there are many people who never get a chance to go back to school just because they had a baby at a very young age. So, old age, young age, below 15, about 35 put you at risk of having a stillbirth. Now, the second thing we'll talk about is diabetes. Like I said, there are many people who don't even know that they have diabetes. But of course, when you are pregnant, you should have diabetes screening. Okay, diabetes is checked during the 24th to 28th week of pregnancy. However, if you happen to have high sugar in the beginning, you might be sent to see a diabetologist very early on during pregnancy. And this applies as well. Don't use a dietitian, use a diabetologist, because pregnancy and diabetes can become, or pregnant women who have diabetes can have lots of complications. When you have diabetes, your eyes can not your eyes might not function as it's supposed to, because of the bad sugar levels. That's if you already had diabetes before pregnancy. In pregnancy, the sugar levels can affect your baby. Your placenta might not function as it's supposed to. You might have problems with your blood pressure. And if you're working only with a dietitian, he or she will not put you on meds like you need to be put on. He would just change your diet for you. And if the diet is not able to control your sugar level, you very likely will have complications like preeclampsia. You have complications like stillbirths. You have complications like a high blood pressure in pregnancy, even if you do not have preeclampsia. It's just very complicated. So if you have diabetes, or if you notice that you have diabetes during pregnancy, it's important for you to get it checked and managed properly. Because despite the fact that people say that when you're diabetic, you have a big baby, it doesn't always happen that way. You might be diabetic and have a very, very small baby because your placenta is not functioning very well. Okay, so diabetes during pregnancy, we've spoken about that. If you are, however, have diabetes before pregnancy, you have to make sure that your diabetologist works with you to have a level of blood sugar that is conducive for pregnancy. This could take about 6 months for your diabetologist and you to work things out to make sure that the sugar level that you have, or your body is in such a stable condition that pregnancy can hold. Of course, if you don't work with your diabetologist and you think that you're taking your meds and you're controlling your blood sugar and everything is fine, you could carry your baby till later on in pregnancy. But because of how pregnancy changes your entire body, you might all of a sudden realize that your blood pressure goes very, very high. And your blood pressure going very high can cause placental problems. The placenta can detach from the womb, you can start bleeding, and you might end up having a stillborn baby. Okay, so it's not worth it for you to do things yourself. I know that there's a lot of information out there that sometimes makes you want to try to um, take care of yourself, take certain medications yourself, or like makes you feel like you don't need a doctor. But pregnancy, or everything that has to do with women and pregnancy, is so complicated that until you are in it, or until you have studied it for some time, or until you really understand it, you don't actually see what it is that can go wrong. You don't actually see how complicated these things can be. So diabetes, if you have diabetes before pregnancy, work with your diabetologist to make sure that you are in good shape. He or she might send you to see a GP to make sure that you're doing okay. You might have to go and check your heart to make sure that your heart functions very well, to check your eyes, to make sure that the diabetes is not destroying your eyes before you get pregnant. You do not get pregnant before any time earlier than 6 months. Okay, if you have diabetes and you're trying to get pregnant, no earlier than 6 months. Later than 6 months, that's fine, because your body might, you and your doctor might have worked things through to make sure that everything is fine. Okay, hypertension. There are lots of women in our society where people don't usually go to the hospital. They they don't even know that they have blood pressure problems. And when they go to the hospital and they're told that they have blood pressure problems, they just run away because they are afraid of the hospital, which is a very, very bad thing to do. If you have hypertension during pregnancy, or if you've had hypertension in your previous pregnancy that caused you to have a stillbirth, it's always important, like I always say, to work with a gynecologist. You cannot work with a midwife. You shouldn't work with a midwife, because midwives are responsible for physiological pregnancies, or for pregnancies that do not come with complications. But if you've had hypertension that caused you to have a stillbirth before, your gynae or your OBGYN would study the case, would ask you when it was that you had that stillbirth, how your pressure was during pregnancy, when your blood pressure started to rise, and if it rose in the first trimester, if it rose in the second trimester, if you had any symptoms before you had your stillbirth, etc., etc. And based on these things, medication is going to be given. There are specific blood pressure medicines that can be given to you right from the start of pregnancy if your blood pressure is high, to make sure that you do not reach that hypertensive state to cause you to have a stillbirth. Okay. um, there are some hypertension medications that are not supposed to be given during pregnancy, because once you receive those, it causes it can cause the kidneys of your baby to stop working. The bones of the baby's head do not form as they are supposed to, and when this happens, your baby is not big enough to be put to be born and put in an incubator. You definitely will lose that baby. Okay, so when you have hypertension and you work with your OBGYN, med to be given to make sure that even before you reach that stage of high blood pressure to cause you complications, everything is already set. You might also be put on aspirin to make sure that despite the fact that you have hypertension, you do not end up having preeclampsia. This is a very important example, or especially in women who are about 35, and we know that there is a likelihood that their pregnancy will be complicated. They can be given aspirin to prevent preeclampsia, or to make sure that preeclampsia does not come too early during their pregnancy journey. So hypertension is easy, or not easy, but it's controllable during pregnancy. Work with your gynae and everything is going to be okay. A third thing, or a fourth thing that can cause, or that can lead to stillbirth, it's problems with your placenta. If you're diabetic, you have problems with your placenta. If you have hypertension, you would have problems with your placenta. These things, or the placenta is an organ that supplies your baby with the nutrients that it needs, and takes all the waste material from your baby as well. Anything that is wrong with this organ that does not allow nutrients to be taken to your baby would be a problem for your baby. Okay, so there are some times that because of your high blood pressure, your placenta removes from the wall of the womb. Once the placenta removes from the wall of the womb, you begin to bleed. You bleed excessively. And despite the fact that you are bleeding, your baby is not getting anything. If you are not able to get to the hospital in time, or if you go to the hospital and you do not have access to a doctor in time, if you're lucky, you would survive it. If you are not, you wouldn't survive it. And most of the time, because of the time rush, many people do come in a bit late, and the baby is already dead. Okay, so placental problems. If your placenta isn't functioning too well, you might have a stillbirth. Umbilical cord problems. There are lots of people who say that, for example, if the umbilical cord is around your baby's neck, or your baby's body, you might have a stillbirth. That usually doesn't happen. It doesn't occur like that usually. There are so many babies that are birthed or that are born with the umbilical cord around your body or around your neck, and it's they're born without any problem. One problem, however, with the umbilical cord is when there's a tight knot on the cord. Okay, so once there's a knot and it becomes very tight, the blood flow from the placenta to the baby is completely blocked. Um, there's the formation of a blood clot in that portion, and because the baby doesn't receive any nutrients, any blood flow, any oxygen, after a while it just stops moving, and it just dies. When you have a baby with a very long umbilical cord, this usually happens, or this is very common in babies who have very long umbilical cords. If you've had a baby with umbilical cord problems before, you can have it in your subsequent pregnancies, and ultrasound scans should be your friend when you get pregnant, because there are many of these things that we can see or during the ultrasound scan. Okay, so when there's a knot on the umbilical cord, it severs or it stops the blood flow to your baby. Your baby does not receive blood flow. You might notice that there's something wrong with your baby, because all of a sudden the normal movements that your baby does becomes very, very fast. Your baby begins to move crazily. It begins to move faster than it's supposed to, or faster than it usually does. And then after a while, everything just goes dead. Everything just goes quiet. If you notice that your baby is not moving like you are used to, if your baby is moving too much or your baby is moving too little, it doesn't matter what whoever thinks about you, it doesn't matter what they're going to do to you when you go to the hospital. It's important that you go and get checked to make sure that everything is fine. Because if you stay in the house because of what somebody is going to think about you, or what they're going to say about you when you go to the hospital, and you go in and it's too late, you are the only one who is going to take the blame. You are the only one who is going to bear that pain because you came in too late. Symptoms in pregnancy are different from woman to woman. If you think that there's something wrong, it's always important for you to go and check to make sure that everything is okay. Don't mind anybody. If you don't go into the hospital, people will not have work to do anyway. So they are there for you. They chose to do this job, and it's your right for you. It's your right to go to the hospital. So go get checked. Follow your baby's movement, and always pay attention to your sixth sense as a mother. Okay, so the next thing that we're going to talk about, previous stillbirth. If you've had a previous stillbirth, there's always a chance that you can have other stillbirths in future. Okay, so what we do when you've had a previous stillbirth is we check what time you had your stillbirth. Okay, so for example, if you had a stillbirth at 36 weeks, and we have no idea what it is that caused your stillbirth, your OBGYN is going to begin to follow you. Is begin to follow you very, very closely. When you get to around 32 weeks, 34 weeks, you will have ultrasounds every week to make sure that your baby's blood flow through the umbilical cord is fine. Your baby's blood flow through the brain is fine, because these are like values, or these are things that can help us to know if a baby might survive or a baby might not survive. In a baby that is not receiving enough blood flow through the umbilical cord, what happens is that because it's going to try to protect its brain, more blood flows into the brain of that baby. And when we look at it on the ultrasound, we will see that, okay, this baby is not the blood flow in this baby's umbilical cord is not normal, and the blood flow in the baby's brain is a little higher than, or is a little more than we expect at this point, and this is not normal as well. This baby needs to be born immediately to prevent stillbirth. If you see these things on ultrasound and nothing is done about it, 100% of the time the babies don't make it. So these are one of the reasons why I say don't work with a midwife, work with your OBGYN who has dealt with these complications and knows what to do, knows how to handle them. Okay, so if you've had a stillbirth before, you would start being very, very strictly monitored 2 weeks or plus or minus 2 weeks before the date of your previous stillbirth, ultrasounds, baby heartbeat monitoring, and you go for ANC more often than normal, and around 38, 39 weeks, pregnancy will be ended, or you will be induced to make sure that everything goes okay. It's not worth it for you to say that, okay, if I've gotten to 39 weeks, I can go to 40 weeks and I can wait for my due date. Lots of babies do die 2 or 3 days to their due date, and that's very, very, very painful, because you've carried this baby throughout the entire 9 months period, and just a few days to your due date you just lose the baby. So please work with your gynae. Sometimes you might think that the gynae just wants money, or the gynae does not know what he or she is doing. Fine. If you think that the gynae does not know what he or she is doing, you can always seek a second opinion. Ask somebody else, ask another gynae, go to a different place and seek a second opinion, seek a third opinion. If they are all saying the same thing, then you should know that there is or there could be some truth in what it is that they're saying. Okay, so stillbirth, it's important for you to be monitored very closely. If, however, we know that, for example, your stillbirth was because somebody hit you in the stomach, or you fell down, or you had an accident somewhere, or you had an infection, these things are like they are managed a little bit differently, because we know that the chances that you would fall again during the pregnancy, or you have an accident, or you have an infection during that pregnancy is pretty low. Every pregnancy is different. But if it has to do with genetic problems, or if it has to do with problems with the placenta, problems with the umbilical cord, etc., etc., the chances that it would happen again during that next pregnancy or other subsequent pregnancies is high. Okay, so you might have a stillbirth because your baby has a genetic problem. In places, where genetic testing is not done, okay, in places where lots of people do not go through the normal antenatal care screening, that, for example, when you are 12 weeks, you go for genetic testing to make sure that your baby is okay and doesn't have any genetic abnormalities. Then when you are like 22 weeks, you go for another ultrasound scan to make sure that everything is okay. 30 weeks, you go for another one to make sure that everything is okay. If something is found wrong, you go for the amniotic fluid or the water around your baby to be checked to see if there could be any genetic testing, etc., etc. In places where these things are not done, we know that there are a lot of genetic conditions that are not diagnosed. Okay, so all of a sudden you might notice that your baby just dies, and outwardly this baby looks okay, but if a genetic testing is done on that baby, you would notice that everything is not okay. So you might have a stillbirth because genetically something is wrong with that baby. Then we come back to this blood clotting problems. There are many people, or there are many women who have stillbirths because they have blood clotting problems. Okay, in that case, your gynae is going to put you on meds to prevent blood clotting right from the beginning of pregnancy, just to make sure that you overcome this problem later on during pregnancy. And this medication is also going to be used 6 weeks up to 6 weeks postpartum, because if you do have a high risk of having blood clot problems during pregnancy, you do have a high risk the first 6 weeks postpartum, and you should be on this medication. Okay, if you're carrying more than one baby, very, very often in identical twins who share one sac, once they share one sac and they move around all over the place, their umbilical cords can get twisted together. And if you have the umbilical cord this way and they get twisted together, of course, the blood flow to both babies would be cut off and both of them die. This can also be seen on the ultrasound. If you have twins which are identical, they have to be monitored very, very quickly. And because of these complications that can happen, the pregnancy usually is ended around 32 weeks to make sure that both babies do survive. Okay, don't carry your twins for too long. It's not worth it, despite the fact that they are 32 weeks, they are pretty mature for twins. Okay, it's better for you to have your twins at that time and put them in an incubator than for you to wait for a long time and lose both of them. So in multiple pregnancies, or in people who carry twins or identical triplets, who share the same sac. This is a very, very frequent occurrence. Even when they don't share the same sac and they share the same placenta, sometimes one twin, some of the blood vessels are connected such that one twin receives more blood and the other twin receives less blood, and the twin that receives less blood does not grow very well and ends up being stillborn or ends up dying during the pregnancy. If this is not noticed very, very early, sometimes once one twin dies, the other twin begins to donate all its blood to the dead twin, and that second twin also dies. Okay, so twin pregnancies are high risk, especially when they are identical, and you need to work with a gynae for that. Okay. It's not the same for unidentical twins because they usually don't share the same placenta. Okay, if you have heart problems during pregnancy, your body is not able to support the pregnancy, and you are at a risk of having a stillbirth as well. If you have sickle cell anemia, you know all the complications with blood clotting and all these crises and things that the sickle cell anemia brings. People or women with sickle cell anemia have very, very complicated pregnancies. There's a higher risk of stillbirth, and if you happen to be one of them, please do make sure that you work with somebody who is able to handle sickle cell anemia, and if possible, have a vaginal delivery, because there's a higher risk of bleeding in people with sickle cell anemia, and lots of them actually do not make it when they go for a cesarean section. So work with somebody who can help you if you fall in this category, and if possible, you should have if you have a vaginal delivery. If you happen to have only one option, which is a cesarean section, make sure that whoever it is that is going to have the cesarean section or going to perform the cesarean section for you is very, very skilled. It's not everybody who can do a cesarean section. When we go into someone, when we begin to do a cesarean section, you never ever know if it's going to end well or not. Sometimes it begins very well, and all of a sudden the womb doesn't contract. You do everything possible and there's really nothing you can do. The person is just bleeding, and if you do not have that experience, or if you haven't dealt with the if you haven't dealt with these similar experiences, for you to know exactly what to do, take the womb out, give this medication, do this, suture this womb this way, that way, you might lose your patient. Okay, so work with somebody who is very experienced. Having a title of gynecologist or being a gynecologist does not necessarily mean that the person is skilled. Skills are learned over time. Okay, they are acquired over time. It doesn't come easy. You have to do so many things for you to become skilled. Okay, so after a stillbirth, we've spoken about these things that can cause a stillbirth. Let me just see if I have any other things that I can add before we go on. Okay, so after a stillbirth, what do you do? It's very, very important that if you think that your baby is not moving, or if you realize that your baby is not moving as it's supposed to, you rush to the hospital. And if it's diagnosed that you have your baby has already passed, you should. Or this is what is supposed to be done for you. Once you go to the delivery room, or once you are admitted in the hospital, you have to have complete lab works done to see if you have problems with blood clotting, to see if you, because of your baby, your inflammatory markers, or you have an infection and the markers are very, very high. You need to be given antibiotics. You need to have lab tests to check to see if you have any infections that could have caused your stillbirth. You need to be given medication that prevents blood clotting, because once you've had a stillbirth, there's a risk of you yourself as a mother having problems with blood clotting. Okay, and once all these things are done, your baby would be induced if possible. Sometimes a lot of women, or some women, come in a little later than they're supposed to, and after a couple of days, when your baby has died, the body begins the blood clotting, um, how do I say this? The blood clotting system of the body begins to work really, really poorly, and you might begin to bleed. Once this bleeding begins, it's very, very difficult to stop it. So if you realize that your baby is not doing very well, go to the hospital immediately before you get to a point where you might have problems with blood clotting and your blood does not clot at all. If your blood does not clot at all, one, you cannot have a vaginal delivery. Two, when you are opened for on the C-section table for us to take the baby out, because definitely the baby cannot be left there. Once you're open and you cut, the clotting does not happen. Okay, so you continue to bleed and bleed and bleed, and in places where you do not have medication that can be given to you to stop the bleeding, then you know that you are not going to make it, because sometimes you can have 4 or 5 transfusions and that is even not going to be enough. If there's nobody going to fight for you, then that's could be your end. So please, if you think that your baby is not doing well, or if you realize that you have a stillbirth, don't run away from the hospital. Go to the hospital as quickly as possible and let it be dealt with. Okay, it's important that if you do have or if the vaginal delivery is successful, you say a goodbye to your baby if possible. Don't say that, okay, I don't want to see the baby, I don't want to touch the baby, because after you leave that place, that's the last time you're going to see your baby. Okay, if you think that you want to hold your baby and say everything that you want or say everything that you had to say to that baby during pregnancy, at that point, just go ahead, hold your baby, sing if you want to, cry if you want to, but it's very important that you say a goodbye. Okay, so we've spoken about that. Your labs, induction if possible. If you can't be induced, the C-section will be done. Going in as quickly as possible when you think that your baby is not doing well, and staying in the hospital if you realize that you have a stillbirth. Okay, these are very important things. What can you do, or how can you, are there certain things that you could do or you could pay attention to during pregnancy that could prevent you from having a stillbirth? Okay, one, you should know how your baby moves during the pregnancy. You should know how your baby moves every day and pay close attention to that movement. If anything changes, go to the hospital to go and get checked. Like I said, it's not anybody's business. Go and check to see if your baby is okay. If your baby is okay, go back. If you think that your baby is not okay, go back again, and they will check for you once you go there as many times as possible. What is important is that your pregnancy ends on a good note. Okay. Um, if you happen to be pregnant and your belly is too small, okay, your baby is not growing as it's supposed to, you should know that in babies that are not growing or that are smaller than they are supposed to, there's a high risk of stillbirth. These small babies are usually found in people who are older, people who have people who have diabetes, people who have hypertension during pregnancy, and small babies are not always cute. Small babies can be very complicated. Small babies need to be monitored very, very often. Okay, so if you notice that during your pregnancy your belly is not as big as you expect it to be, you can have a normal tape measure at home. Okay, when you put the tape measure on your belly from the top of your belly, how you see it big, to your abdomen where your the pubic hair starts to grow, the very top of where your pubic hair starts to grow, and you measure it, it's supposed to be almost the same as how many weeks you are pregnant. Okay, so if you are 24 weeks, your belly is supposed to be, the tape measure should measure like 24 weeks. If you're 25 weeks, you should measure 25 weeks. If you realize that you are 24 weeks, or you are 30 weeks, and this thing is measuring like 20 weeks or 25 weeks, this is a big problem, and you have to go to the hospital immediately to to see if your baby is okay. It's not enough for the midwife or for your OBGYN just to listen to the heartbeat of the baby and say that, okay, there's a heartbeat and everything is okay. You can listen to the heartbeat, but listening to the heartbeat does not tell me if this baby is going to is not getting enough oxygen, or if this baby is supplying too much blood to its brain because it's not getting enough blood flow from the placenta. But if you have an ultrasound down, or if you have the baby monitor, that paper, that the machine that you go on to check the baby's heartbeats down, that paper can tell me that this baby is not doing well and I need to deliver immediately, or this baby is fine, I can monitor every other day, or I can monitor every 2 days, or I can monitor every other week. An ultrasound will also tell me the same thing, that this is an SOS call, I need to end this pregnancy. But if I'm just listening to the heartbeat, it's not enough. So listening to the heartbeat is not enough for you to know that your baby is okay. Okay. If you've ever had a stillbirth, it's important that you make an ultrasound your friend. Have as many ultrasounds as possible. It's if it's okay, or if you can afford it, every 2 to 4 weeks you should have an ultrasound done to make sure that your baby is okay, especially around the time that you had your stillbirth. So if you had a stillbirth at 30 weeks, 28 weeks you will have an ultrasound, and it's not just an ultrasound to see if your baby is alive and if you how big your baby is, or if there's water there. It's important for you to ask, if possible, for the sonographer to check the blood flow of your baby's the umbilical cord, how the blood flow of your umbilical cord is working. You can also ask the sonographer to check if the blood flow in your baby's brain is okay. These are things that are not done during normal ultrasound screenings, but if you do ask for it, every sonographer should be able to do this. Once you get this test, you can always seek a second opinion from a gynecologist, and they will tell you if the if the figures that you've gotten are okay, or if the figures that you've gotten are not okay. Make ultrasounds your friend. Pregnancy is expensive. Once you want it to end on a good note, sometimes you have to make sacrifices. Sometimes you have to invest a lot of money into it. If you are not willing to do that, there are sometimes that you can go through without a problem, even if you don't invest in it. There are sometimes that you have to make pretty large investments to make sure that everything ends well. And this is one example. Invest in your pregnancy if you've ever had a stillbirth before. It's really important. Um, if once you have a stillbirth, it's important for you to mourn with people around you. You can go into depression very, very quickly because of how painful that loss is. Like, nobody knows how painful that loss is, unless, of course, that person has experienced it before. You have experienced a loss or two, and you know exactly how it feels like, and you very likely would not want to go through something like that again. So have people around you, not necessarily everyone who would just be a nuisance to you. You can ask for your privacy. You shouldn't allow anybody to step on your toes and just disturb you just because they can. Find people that you think you can gel with, people that will make you emotionally better, people that affect your life positively, and spend time with them such that they are able to lift you up from that low point in your life. If you've had a stillbirth before, or if you had multiple miscarriages, it's okay. It's painful, yes, but pregnancies in the future do not have to end on a bad note. Pregnancies in the future can end on a good note, and they will end on a good note if you work with somebody who understands what it is that you're doing. Okay, so don't lose hope. Everything is going to be okay. Take your meds if possible, and work. Like I said, work with somebody who knows what they're doing. If you're having multiple miscarriages, like I said, take your folic acid, eat well, no herbs, no unnecessary extra medications, and drinking this and that might affect your pregnancy. Okay, take your folic acid, eat well, sleep well, exercise if possible, try to lose weight if possible. Pregnancy would very likely end on a good note. If you're having more than 2 miscarriages, seek help from your gynae. Let them prescribe the combination of meds for you to make sure that your pregnancy holds. If you have more than 3 miscarriages, get a genetic testing done. Go with your partner to see if he's not the problem. Once a problem is sorted, you will very likely have your pregnancy, or you very likely have your baby. If you've had a stillbirth, like I said, get somebody who would monitor you, and get someone who knows exactly what it is that they're doing, such that they are able to walk you safely through your pregnancy. It's painful, have support, and you will be fine. I hope that I have been able to at least teach a thing or two. If you have any questions, please do let me know. This video is going to be in the group for as long as possible. I am not going to close the group, so you can always go back and listen to it in bits if you want. Let me know if I haven't responded to your question, if I've left certain things out that you need answers to. I would put a post in group right now. Just comment all your questions under that, and I would take my time to answer every single question. I hope this workshop has been helpful. Thank you so much for joining me, and hopefully I'll see you again during my next workshop. Thank you. Have a good night. Bye bye.